for quite some time. He specializes in all things chiropractic and orthotics. He's been a member of BNI Fast Forward for quite some time, and is basically one of our star members. He's fantastic at connecting with people, which allows him to bring lots of visitors to the group, to bring referrals to the group, and be a very productive member of the group. What else can I say? Do you need more of an introduction, Dr. Michael?
Thank you.
Something about crack and tequila.
Awesome. Okay, thanks so much. Well, hi everybody, Dr. Michael Horowitz. Welcome to my feature presentation. As you know, I'm the owner of Hycroft Chiropractic and Vancouver Orthotics. Next slide, please. I opened Hycroft Chiropractic in 2001, and in 2005, I started that second business, Vancouver Orthotics, as a separate entity under the same corporation, both essentially interconnected. Next slide, please. So what I want you to know about me is that I'm not just your friendly neighborhood chiropractor. I'm also a person who's experienced a lot of back pain in my life. When I was 13, I remember complaining to my mom after hockey that my back hurt. When I was 18, I bent over to pick up a baseball and was floored with sharp shooting pain in my low back, which took weeks to recover. When I was 32, I had a severe sciatica, which I explained as a show-stopping shooting nerve pain down my right leg. In 2013, I was hit from behind in my car and experienced a whiplash and a soft tissue neck injury. And just last year, I had a 3-month episode of plantar fasciitis, which is a deep, achy, debilitating pain in my right heel. Next slide, please. So I guess you can say that I've done my field work and I've got a lot of experience to share. And I think that this has given me the opportunity to empathize with my patients and also share my experiences, not just as a chiropractor, but as a human being. Next slide, please. Why chiropractic, you may ask? Next slide. First, I believe in treating the source of the problem, not just the symptom itself. Second, I really appreciate the natural, holistic approach. And third, I love helping people and I love problem solving. Next slide. Chiropractic requires me to diagnose and treat a variety of musculoskeletal conditions. That's the MSK. So here's my top 10 list, and you've often heard me talk about the meat and potatoes of chiropractic, which is neck pain and back pain. But as you can see, there's much, much more than just neck pain and back pain. Next slide. And did I mention that my father's a pharmacist? So the pharmaceutical approach, or what we know as conventional allopathic medicine, suggests that there's a pill for every symptom we encounter. Next slide. This never made much sense to me. Masking the symptoms doesn't make you healthier, it makes you numb. Now, please don't get me wrong, obviously medicine has its place, but Advil, or tequila for that matter, doesn't solve back pain. Next slide. So, given the hands-off environment that we're currently in, my ideal right now is someone who's experiencing a musculoskeletal condition and would like to schedule a telehealth video consultation with me. They say 80% of the diagnosis is in the consultation. And so there's a lot of value added that I can provide just by speaking to people and giving them guidance around stretches and exercises and giving them some home remedies and home methods for treatment. I'm also able to help orthotic reorder patients from past patients that I have their foot exam. And at the end of my presentation, I'm going to ask a little favor from all of you. Next slide, please. Since I'm always trying to focus on the source of the problem, looking at the feet makes a lot of sense. After all, our feet are our foundation. Shock absorption and body mechanics requires proper alignment of the feet and the spine. Next slide. So if you think about it, generally speaking, we're asked to take 10,000 steps a day. At 150 pounds, that's equal to 1.5 million pounds of pressure through your weight-bearing joints. What's a weight-bearing joint? Your feet, your ankles, your knees, your hips, your back. And so no wonder so many people are complaining about foot, feet, heel, ankle, knee, hip, and back pain. Next slide. And the feet don't lie. If you look real close, they'll tell you a great deal of information. I ask all patients to bring in 1 or 2 pairs of shoes that they typically and often wear. The bottom right corner picture, the gentleman sitting with his feet. I was actually in Amsterdam 2 years ago, and I was just having lunch with a friend, and I can't help myself. If I see it, I have to take a picture, and it just shows you so much of the wear pattern that takes place in people's heels, in the balls of their feet, and it makes a lot of sense that a lot of symptoms develop in those areas. Okay, next slide, please. So Vancouver Orthotics represents 75% of all my patient visits, and I take my role very seriously. Next slide. I've invested in 2020 technology, a 3D foot scan, and an electronic gait scanner. And there's nothing wrong with a foam box or plaster cast technique, but they're so 1970s technology. And I used to use the foam box technique for capturing people's foot arch. The plaster cast I never used. But again, there are a lot of practitioners in the city still using foam box and plaster cast. But for me, I take this really seriously, and I invested in both of these technologies in order to maximize the results with patients and give people the best possible experience. For all patients, I offer a 3-month, 6-month, and lifetime warranty, as well as a kids outgrowth warranty program, which can be applied for up to the age of 18, since kids are growing so much up till 18. Next slide, please. So Vancouver Orthotics can fit into your favorite shoes. There are many types of orthotics that I can make for all the different activities that you may engage in. The most popular ones that you might see here are the sports, the casual, the dress, the high heel, cleats for like soccer and football, or ultimate frisbee, and work boots, because I do have a lot of people that are in the trades industry that are on their feet so much and feel a great deal of discomfort going up ladders, down ladders, and just being as physical as they are. Next slide, please. All right. So thank you for watching my presentation. Before I take your questions, I do have a call to action or an ideal referral that I'd like to ask of you all right now. The next slide. So my office has space and referrals for a registered massage therapist. If you know an RMT, or a registered massage therapist, looking to start or relocate their practice, please introduce them to me. Not only could they be a great fit to BNI's Fast Forward chapter, but like I said, I have a lot of patients that I can refer to a registered massage therapist. And I'm really grateful to have Ryan, our kinesiologist, and Ryan, our physiotherapist, and Dr. Annie Savage, and all those other people involved in the physical aspect of helping people get better. I do really believe in a team approach. Next slide, please. Okay, so since I can't see patients at my office right now for hands-on treatment, my call to action is to ask if my members could leave me a Google review or a Yelp review, or subscribe to my Vancouver Orthotics YouTube channel, which I have at this point over 200 videos. I guess when I take things on, sometimes I go overboard, but I'm having fun with it, especially sharing a lot of different stretches and exercises and concepts around chiropractic and orthotics. And so if you're connected to social media like Facebook and Twitter and Instagram and LinkedIn, you may see some of my postings. I try to do them 3-4 times a week. And if you see them, it would be so helpful if you could like them, comment on them, and share them, because naturally I'm trying to expand my reach, and community exposure and awareness is something that I'm always trying to work towards. Okay? Top of mind. Next slide, please. Okay, so there you have it. I'd be happy to answer any of your questions that you might have. And I just want to thank again Humphrey for guiding me on preparing this PowerPoint presentation. All right. Questions away.
Thanks, Michael. Does anybody have any questions for Dr. Michael? I'll ask you a question. When the gentleman was sitting with his feet crossed underneath his what was that a sign of for you? Because I know that's something that I do for myself a lot. Sit with my feet crossed underneath. And
I mean, there's a couple aspects to that, right? At that point, I was just looking at the wear pattern of the bottom of the shoe, right? Which I encourage all of you to do. The wear pattern says a lot. A lot of people wear the outside heel, right? So they're wearing the outside heel. When the foot is going through movement, it goes through a state of pronation and supination, so falling down and then rolling out. What we want to avoid, and one of the purposes of custom orthotics, is to prevent overpronation or oversupination. Seeing external wear of the heel tells me that that patient is probably overpronating. Not to mention, in the ball of the foot, there's a very common condition called metatarsalgia, which can be associated with bunions or painful ball of foot area. And again, wearing in that pattern of the shoe is one of the signs that helps guide me towards the possible symptoms. The part about crossing your legs, I mean, crossing your legs under a seat's not the worst thing in the world, but when you're sitting, like all of you that are sitting right now, if you're crossing your legs, if one leg is crossed over the other leg, there might be a tendency that 80% of the time, that leg is going over the other leg, which creates asymmetry, it creates twist and rotation, and possibly misalignment of the spine and the pelvis. And this is what I'm looking at all the time. I'm looking at people's posture, and people say, well, why is my shoulder higher? Why is my hip, So it's a long answer to this question, but all patients that come to my office, I take them through a 5-step process for improving posture. And when you have better alignment and better posture, you typically have less symptoms.
That's great. Thanks, Dr. Michael. Arsen, you've got a question?
Yeah, my question is this: during these times, these COVID times, what kind of assistance are you able to provide over Zoom or other type of video links?
You betcha. So Zoom or what we call telehealth, right? Because it's a video session where I can look at that person and speak to that person, and basically, people are doing things differently. Maybe they're at home more, sitting on the couch more, or maybe they're out and walking more, or they decided to get into running and they think running 5 times a week is a good idea. From 0 to 5 times a week, it's not a good idea. So, I really enjoyed the diagnosing. So when you tell me what's going on, I hear that information and I can help formulate what a possible diagnosis or differential diagnosis might be. And then I can also come up with some great recommendations like, hey, maybe don't run 5 times a week, maybe start 1 or 2 times a week, and maybe don't go for an hour each time, maybe start with 15 or 20 minutes. So I can give some insightful information, help formulate a diagnosis, come up with some recommendations or modifications. And like I said, 80% of the diagnosis is often just in the consultation, just in the discussion. At stretches, exercises, home care, right?
That's great. Ryan, you had a testimonial, and then Zach after that.
Yes, so I've known Dr. Michael Horowitz for the better part of 10 years, and I've used a lot of different chiropractors, and I've seen a lot of different styles and goals of treatment, and I have yet to see anyone that matches up to Dr. Michael Horowitz. He takes a lot of time to work with you, and you feel like you're getting special star treatment. And this isn't common in the field. It's a lot of get you in, get you out, crack, and pat on the butt, see you later. But he takes you, and he really wants to know what's going on in a very comprehensive manner. Not only have I seen a great deal of chiropractors, but I've worked with a bunch, and he's very, very thorough. And at the end of the day, he wants to make a difference, and he wants to help people. So highly recommend him. And, as I've seen a number of chiropractors through the years, I always come back to Dr. Michael because the quality is unsurpassed. And that's ultimately how I came back to the group.
Thanks, Ryan. Thank you.
Okay.
Dr. Michael. My question is when we're out there and you're looking to have people come your way, are there key words that people are saying, like, oh, my feet hurt, or shins hurt, or my body hurts, that you would like to, that way we can kind of say, hey, I have somebody who might be able to help with that? Or is it kind of just an all round, if they say anything you want to hear, or something specific?
Absolutely. That's a great question. I probably, like, I only have a minute to answer that. But in a nutshell, I recently did a BNI advanced presentation, which talked about, how to give a good referral. Look for people, sense what's going on. Listen for people that are planning, that are bragging and complaining about things, right? So let's talk about sensing. It's pretty clear when someone has neck pain or back pain. You don't need to go through any form of medical school to know that. You can see it in their face. You can see it in the way they move. You can see it how it affects their energy, their mood, their motivation, and just their general joy in life. So number one, if you see or if you sense that someone is moving in pain, and there's someone that you're close to, or that you can, ask them what's going on, and ask them what's going on and what they're thinking about doing about it. People complain. If they're in pain, they typically complain. And not only can you see it, but they will talk about it. People still don't have a full, like, I'm fortunate that I've got a great team here that's learning about chiropractic, but people still think that we crack backs, right? That's what chiropractors do. And I hope you guys all realize that's not what we do. I guess I just want everyone to have the opportunity, if someone is considering going for massage or physiotherapy, which are great complementary and supportive professions to chiropractic, maybe suggest to that friend or colleague of yours, hey, have you also considered chiropractic? They do things a little bit different than the physiotherapist, or a little bit different than the massage therapist, right? So sense what people are doing, and then listen to people that are complaining. Weekend warriors, you know what I mean? But anyway, my time's up. But
Michael, I'll get you to jump. Maybe you and Zach could do on a one-to-one a little bit more details about how to find that and how to find the best referral. Harold, we'll let you have a question, and we'll just kind of try and answer it.
Yeah, thanks, Dr. Michael. Hi. I just had a question. You mentioned that you design orthotics for various sports or various activities. I've only ever had one, and I run, so I was just wondering, would that be an idea that I should revisit?
Yes, because it's almost impossible to make one orthotic fit every kind of shoe that you have. First of all, running is different. It's mechanically different than walking, which is different than rollerblading or skiing, or for a woman for wearing high-heeled shoes, right? Mm-hmm. So I think one of the things that I take pride in is making sure that we make the right type of orthotic for you based on the activity that you're going to be doing. If you're going to play basketball, that's different than jogging, and that's certainly different than going casual flip-flop shoes, right? So my orthotics are not just custom to your feet, but they're custom to your footwear and the activity that you plan on doing in them.
Thank you. Just one quick question. Do you use Zoom for your consultation, your virtual consultations?
Through my online booking system, I use Jane. It's a booking system, and it has telehealth video built into it. But okay. So that's one way that I would prefer to do it, because then it's through my online booking system. But hey, I've called people, I've called patients, I've FaceTime patients, I've Zoomed patients, I've telehealth patients, and I've Facebook Messenger patients, and et cetera, right? People have needs, and they need help, and I'm happy to talk and chat and guide people through this period of time.
Thank you, Dr. Michael.
Thank you.
That's great. Thank you, gents. So now we know more about Michael and what he does. Let's do our best to find him some referrals, especially now. It might be a little bit more challenging, but I know that some stretching and mobility help is always handy in these times when we're sitting in front of our desk a lot, or working in uncomfortable stations. It is now time for our Secretary Treasurer's report. He's going to tell us a little bit about what it's going to take to become a member.
All right, so visitors, now that you're